And our Bronson Health Chat segment this morning is going to deal with a topic perhaps you don't want to deal with, and that's flu season, but it is here. And with it comes a lot of questions about where to go for care. Many people head straight to the emergency room when they feel sick, but that's not always the best place to go for flu symptoms. Today, we're joined by Dr. Mark Kerschner from Bronson to talk about how to care for yourself, when to seek medical help, and the faster, most convenient options available to get to the care you need. Dr. Kerschner, good morning.
Good morning. Thank you for having me.
Pleasure to chat with you this morning on this topic. What are the most common flu symptoms?
There are a lot of flu symptoms. Most common can include cough, body aches and muscle aches, headaches, sore throat, fever, nausea, vomiting, and diarrhea, and in some cases, chest pain and shortness of breath.
So if we started experiencing some of these symptoms, what do we do, and when do we need to seek medical attention for those symptoms?
Sure. For the far majority of people, the treatment is just going to be what we call kind of symptomatic care, meaning if you have a sore throat and throat lozenges are going to help, or if you have a cough and over-the-counter cough and flu medications are going to help. For body aches and muscle aches and headaches, Tylenol and Motrin or ibuprofen are things that we're going to recommend, because for the most part, the flu is a virus, and there's nothing to make the virus go away. It's just supportive care. However, in certain situations, if people are having significant nausea and vomiting and are unable to hold fluids down, or if people are having shortness of breath or chest discomfort, those are the cases where we recommend seeking care.
Who is most at risk for flu symptoms this year, Doctor?
It's going to be people at the extreme. So the people most at risk are elderly, people who are immunosuppressed, people who may be taking medications for cancer treatments or transplants or things similar to that, as well as our youngest patients, infants and toddlers.
Our guest is Dr. Mark Kerschner, emergency physician at Bronson. And doctor, why is the emergency room not the best place for people to go with flu symptoms?
Well, what we really want to do is we want to provide value. In the emergency department, we're happy to see anybody anytime, but to be open and honest, we're very busy. And so what we want is we want the patients seeking the right care at the right place. So for patients who are having chest pain or shortness of breath or significant vomiting, we're always happy to see them in the emergency department. If you have just muscle aches or body aches and you're just not feeling well, there are a wide variety of options. You can call Bronson Care Advisors. There's the Bronson Fast Care and Bronson Urgent Care, as well as people just contacting their primary care provider through their Bronson MyChart, or in some cases, the ability to do video visits. And in many of those cases, if it's felt that you need to seek a higher level of care, you'll be advised to come and see us in the emergency department.
So, Dr. Kerschner, what's your advice for those who want to maybe prevent getting the flu at all during this season and to protect those vulnerable groups that you talked about?
Yes, I agree with you, right? The best way to not have to see us is to avoid getting the flu in the first place. So starting all the way back in the fall is getting immunized. Unfortunately, only about 25% of the state population gets immunized against the flu, and that's going to be your best protection, right? If you don't get the flu, you don't have to worry about coming to see us for your flu symptoms. Second is, if you are sick, and whether you have the flu or any sickness, stay home. Don't go to work. Don't send your kids to school. Don't send your kids to daycare. That's just going to protect others in the community from getting sick. So it's okay if you're not feeling well to stay home from work. It's better for you, and it's better for the community. Whether covering up for washing your hands, covering your cough, covering your sneeze, distancing yourself from others, especially if you are at home with people who you live at home with people who are at risk for getting the flu and you happen to be sick, keep your distance.
Well, flu season is here, and with us this morning on our Bronson Health Chat to answer some of the questions that go along with flu season is Dr. Mark Kerschner, emergency physician from Bronson. And Doctor, we appreciate your time and thanks for sharing this valuable information with us this morning.
Again, thank you. Thank you for letting me participate.